enrollment meeting. We've got representatives from Unum, Aetna, and from Mercer. And so we are going to have Elsa start off the meeting and kind of then we'll go through our Aetna enrollments or benefits for 2017, and then we'll have Unum start with all of our extra insurances as well. So I guess we'll go ahead and get started if Elsa wants to get going.
Good morning, everyone. Thanks so very much for joining us here this morning. So we are kicking off open enrollment for the 2017 benefits year. So in the next week or so, week and a half until just before Thanksgiving, you're going to want to make some thoughts as to what you want to do for the next calendar year for your benefits. And today we're going to go over your comprehensive benefits program, where you have quite a number of medical options. You have 2 dental options with Aetna and also a vision plan. And then our representative from Unum is going to touch upon the basic and voluntary life and AD&D and also voluntary benefits that are offered through the company, as well as the EAP program that's offered through their partner Ceridian. I'm going to touch upon healthcare, independent care, flexible spending account, a way to reduce your taxes. And then we're also going to have a representative from your 401k consulting company to talk about how you can also save money for retirement. So I just want to touch upon a few things before we get started. Like I mentioned earlier, open enrollment is going on now between now and through November 23rd, which is, I think, right before Thanksgiving on Wednesday. And this is the one time a year that you're going to want to think about what you want to do for the upcoming plan year in terms of, you know, if you're going to participate in medical, if you're going to drop anyone from your program, or if you need to add someone to your insurance. You cannot do that in the middle of the plan year unless you have a qualified life event. Some example of those are like a marriage, a divorce, birth of a child. And if you do experience one of those changes, you're definitely going to want to touch base with Human Resources or go into the ADP website and note that you have a family status change event and then make that change. For example, if you get married, of course, you can add your spouse, or maybe you got married and you're going to go onto your spouse's insurance, so you could drop Power Plus's insurance. So you have to make a change that's consistent with the event that you have. And then you're going to want to log into workforcenow.adp.com by next week to enroll in benefits, and also call the Unum enrollment line to learn more about any of the voluntary benefits if you haven't participated in the past, or if you're a new hire since last year, you're going to want to enroll in voluntary benefits, and that's like hospital indemnity, group accident, short-term disability, or even whole life insurance. So you guys have probably heard of Obamacare or healthcare reform. Just want to make sure you're aware of it. Some of the good news that has come out because of healthcare reform is expanding Medicaid. So, you know, more people potentially qualify for Medicaid. It is, of course, based on your income levels. So you'll want to find out if you qualify, but more likely than not, most likely not, you won't qualify for Medicaid. But I just want to make sure you guys all know that that is out there. One important thing that you do need to know about is the individual mandate that is continuing into 2017, where everyone in the U.S. is essentially required to have health insurance or pay a penalty. And pretty much any legitimate healthcare coverage will satisfy the mandate. Of course, your insurance through Power Plus qualifies. If you're on Medicare, Medicaid, or if you were a veteran, or if you're an Indian in the Indian Health Services, or even TRICARE, all of those qualify to have health insurance. And if you don't have health insurance, you know, it's of course your choice. Just know that you'll be paying a tax penalty, which is 2.5% of your taxable income. That would be up to $695 per adult, you know, about $350 or so per child, to a maximum household penalty of over $2,000. And of course, you don't get anything in return for that. You know, you're just going to owe the government over $2,000 for not having health insurance. So really think about joining Power Plus, or if not, you know, spouse's coverage or any of the other legitimate healthcare coverages that you can get a hold of. And then you also do have the choice of considering California's healthcare exchange, which is called Covered California. And you can get some more information at coveredcalifornia.com. And there are a number of, you know, options in the area, you know, more HMOs, more PPOs of different plan designs. Just know that, you know, they talk about possibly being eligible for subsidies on the exchange. But you guys at Power Plus are not eligible for subsidies because the company does give you an option to purchase affordable minimum value healthcare coverage for $217 for employee-only coverage. So definitely ignore any of the hype about you guys, being eligible for subsidies because unfortunately you are not. But you can just purchase and pay the full price of the healthcare coverage on the exchange if you are interested. So with that, I'm going to turn it over to Letitia Owens. She's with Aetna. I think you guys are all familiar with her. She's been here for a couple years now, and she's been really helpful, and she's going to go over all the medical, dental, and vision options that you have for 217.
Good morning, everybody. Thank you for being here. Now, the first thing that we want to make sure that everybody knows is that if you're currently happy with the benefits that you currently have, you will not need to re-enroll with Aetna. What you have in front of you are the 3 HMO plans. The second column starts with the full HMO, the middle is the HMO deductible, and then you've got the basic HMO. What's most important here is that if you are in need of St. Jude, St. Joseph, Hoag, physicians or specialists, then you will want to make sure that you're enrolled on the full HMO plan. That is going to be the key item. Now, if you're not interested or do not need any services from those IPAs, then you want to definitely make sure that you're looking at the HMO deductible or the basic HMO to enroll under. So high level on the full HMO, no changes here. As you see, there's no deductibles, out-of-pocket maximum. That's going to be your total risk. So as you're utilizing your benefits throughout the year for yourself and your family members, once you pay out that total amount, you'll be covered at 100%. Now, as an individual patient and an Aetna member, it is your responsibility to make sure that you are keeping track of your co-payments, that you are paying out of pocket. So make sure that you're setting up a file for medical care, and once as an individual you've paid out $1,500, then you would call out member services to Aetna and let them know you've met your max. They will require you to fax in all of your receipts, and then we're going to contact your medical group to let them know you've met your out-of-pocket maximum for the year. So then all services for the remainder of the year are covered at 100%. Along with that, your doctor visits, it's $30. Now remember, your doctors are part of the medical groups and work with your IPAs to obtain authorizations and approvals. So if you need to see a specialist, make sure that you are working with your doctor and your medical group to obtain those authorizations before seeking care through the specialist. Inpatient hospital, $750 copayment. So if you're there for a day, a week, or a month, okay, the max you'll pay is $750 under the full HMO. Outpatient surgery, $200 max out of pocket. Do know that you will at times receive bills at home, and you will be shocked to see that it could say $12,000, $20,000, $60,000 for those services. Please do not pay that amount, just pay your copayment. What's more important here is looking at your prescriptions. No changes again for generic, brand, or non-formulary. Your doctor is going to work with you to make sure that you're taking the proper prescriptions. So generic is $10, name brand is $30, and the max you'll pay under the full HMO is $50 for a 30-day supply. We do recommend for you to take a look at your community stores because Costco allows you to come in and utilize their prescription facilities. You are able to look at CVS, Targets, and if you're using generics that are at the community stores, some of those locations are offering generics at $4. So it's a great way for you to save money, but as a consumer, it is your responsibility to make sure that you are seeking these cost savings throughout your communities. So please take that time to research because prescriptions are very expensive, but as you see here, you still have a very rich 3-tier program. Emergency, $100 copayment, no change. Ambulance services, $100. So I want to take a few minutes just to kind of talk about emergency room. It's very important that you're only utilizing the emergency for true life-threatening situations. That would include car crash, severe, if you have a heart attack or a stroke, those are going to be true life-threatening situations. If it is not under those circumstances, then you definitely want to work with your doctor, call them directly, or be proactive and find out where your urgent care centers are located. Urgent care centers are typically open late in the evenings and on Saturdays. So again, be proactive, talk to your doctor, reach out to your medical group, or go on to Aetna Navigator and find out where your urgent care centers are located based on your medical group. Okay? Along with that, X-ray and lab, 100% complex imaging, that would be your MRIs, PETs. Those tend to start about $1,500 and could go up to about $3,000. So the max you'll pay here is $100 under the full HMO. Okay? Middle tier, HMO deductible. This is where you're going to see a couple of changes on the PCP and specialist. That did go up this year starting January 1st of 2017. Otherwise, all the other services are the same. I do want to spend a little time on the top where it says deductible. The HMO deductible does require for you to pay first dollar for any hospital services, any type of surgeries. But if you do not have any of those medical services throughout the year, then you'll never have to meet that deductible. So for example, I have not been in a hospital for 20 years after the birth of my youngest. So keep in mind, it's only going to affect a very small population of employees that would have to meet that deductible. Otherwise, you're just paying $20 off the office, specialists are $25, your generic prescriptions are $15, brand is $25, and the most expensive is $40 for your prescriptions. So again, very minimal changes here on the HMO deductible on the primary care physician and specialist co-payments. So what you will see is that anybody that's currently under this plan, the HMO deductible, if you're on the Aetna Navigator, you will receive an email to alert you that you will have a new Aetna ID card available through the Aetna Navigator. And you would have to log in to print, or you can download it onto your smartphone. The last benefit there is basic HMO. Again, no changes, no deductible. You do have an out-of-pocket maximum of $3,000 for an individual. Family is $6,000. Doctor visits, it's $30. Specialist is $30. Remember, you must work with your doctor and your medical group to seek care through a specialist. Inpatient hospitalization is $600. That's the max that you'll pay for a visit. Along with that, surgery is $300, and your prescription is $15, $35, and $50. Again, emergency room is $100. And please work with your doctor or take a look at the urgent care centers in your area so that you're not in the emergency room and paying $100. Okay.
We do want to point out, do we have people from Northern Cal on the line today? Okay, so the basic HMO is not available in Northern California. So you guys have the choice of the HMO deductible and the full HMO, but I believe everybody else on the phone has the option of all three HMO options.
Perfect, thank you. Now, here we have your Open Access Man's Choice, also known as your PPO plan. I'm not quite sure how many people in the audience are on this, but I know it is a very minimal amount of employees that are enrolled across the company. Do know that there is no changes going into 2017 on this benefit. So I'm just going to do high level on the open access. And then if anybody needs some assistance on this, you can definitely let us know. I can give you a call directly. So on the Open Access Man's Choice, what that does is it gives you the flexibility of managing your own health care. So ultimately, if you want to seek care through a specialist, a cardiologist, dermatologist, without seeking care through your primary care physician, you can do so. You're managing your care, but with that comes with a lot of responsibility to make sure that your doctor, your specialist, surgery centers, x-ray, complex imaging facilities are all in network, so that way you get the highest benefit level. So with this, you do have cost sharing, which is your deductible. So if you enroll as an employee only, you pay $1,000 first, and then Aetna steps in to help you pay for your medical bills. If you enroll yourself or your spouse or with children, then your deductible is $3,000. So that's going to be your cost sharing up front. Once you've met that, your total out-of-pocket maximum as an individual is $3,000 when you go in-network and seeking care through contracted providers. But if you go to a doctor that's not part of the Aetna plan, your total out-of-pocket maximum for an individual could be a minimum of $6,000. So keep that in mind. So that's why it's really important for all individuals that are on this plan to make sure that you're checking that your doctor, the specialist, every step of medical care that you're taking, that they are contracted with Aetna, so you pay your fees at a contracted rate. So along with that, your prescriptions, $20 for generic, $35 for name brand. The most expensive prescription there is $60. Again, work with your provider to make sure you're taking the correct prescriptions. Along with that, you've got your emergency room. You'll see it's a 20% after deductible. So again, this is going to be a plan where you're going to have cost sharing. So you definitely want to take a look at this to see if this is the plan that's working for you, or if you want to enroll in for January 1st of 2017. The other plan that you have on the far right-hand side is your high deductible health plan, HSA. Now with this, you can see the $5,000 individual deductible and $10,000 for a family. So this here is going to allow you to still seek care where you wish. You're managing your health care, but you can see that the deductible is high, your out-of-pocket maximums are high, and that's because with this plan, you're able to set aside a health spending account where you can pre-tax put away as an individual $3,400 or as a family $6,750 to help pay for your medical care. Now this amount you would actually be able to set up directly with your bank, and what would happen is as your money is being put in there through payroll deductions, you'll be able to pay your medical co-payments, dental, vision, any medical care that you might have throughout the year. Most important part of this is that you don't lose the money that you put in your health spending account because it's yours. You will be able to take that with you anywhere you go. So it's really important that you kind of take a look at these plans. Again, very minimal employees are participating on this. It is a great benefit on the high deductible HSA plan. As you hit 55 years old, you're able to put in an additional $1,000 a year into your health spending account. So keep in mind, every year this money just will accumulate time after time. Now, if you don't use it to pay for your medical care, once you hit 65, you'll be able to withdraw that money and utilize it to pay for premium, for Medicare, for any other services. A lot of individuals will ask, well, can I use the money in the HSA account to buy a nice big TV? You can't, because it is governed by the IRS. So the IRS could always come back to you and ask to see receipts for your medical services and how you utilize that money out of pocket. So a great benefit. It is a little bit more complex. So if anybody is interested in this plan and need more details, please let your HR team know and we'll definitely reach out to you directly. Okay. Along with that, Aetna Navigator is your member website. It's available 24 hours, 7 days a week. It's in English, and you can actually translate this into Spanish. If you look at the top right-hand side, it says En Español. Right there, if you click that button, the entire website will go into Spanish. So do know that you have that ability. You now have access to your ID cards, your claims, your medical information, your prescriptions, any step of medical care that you take with Aetna over the last couple of years. All your data is here at Aetna Navigator. So it's a great resource for you. On the far left-hand side where it says I want to, it's a quick review, how to find your doctor, how to get your ID card. So keep in mind, if you lose your card and you need another copy, you no longer have to go to HR. You don't have to call Aetna Member Services. You can easily just go onto Aetna Navigator and print it within seconds. Or again, you can download it onto your smartphone. So a great resource for you. How to find your doctor. The next couple of slides will kind of show you how to go onto Aetna.Find and locate those contracted doctors. So most importantly, you need to know what benefit plan you are enrolled under. If you don't remember, you don't need to contact HR because it tells you on your card. It will also tell you go onto Aetna Navigator. So it's important for you to know what medical product you're enrolled under, because that's going to determine as to which plan you select under Aetna.Find. Okay. Once you go into DocFind and select your plan, this one's using the Open Access Managed Choice. You can see that it's going to give you the doctor's information, their address, their phone number, their specialties. It's also going to let you know as to what hospital affiliations that they're part of. So this is a great resource for you if you're looking for new specialty care providers. Here's a copy of just an Aetna ID card so you know what to look for. When you're on Aetna Navigator and it says get an ID card, it'll kind of just take you step by step. Step 1, step 2. Are you getting the card for yourself? Is it medical, dental? You could definitely print both of them here. On the right-hand side where it says number 3, it'll show you right under the Aetna logo, the W number. So when you call into Aetna Member Services and they ask for your information, your Aetna ID, that is what they're looking for, the Aetna W number. Okay? Thank you. Here's information in regards to how to download your Aetna app onto your phone. Now, I love this resource because if you're out and about, I never leave home without the phone. So if I happen to have to go to a specialist or to the doctor, I can easily just show them an Aetna ID card from my smartphone. Along with that, on the downloading the Aetna app onto your phone, you're going to be able to also find your urgent care centers. You're also going to be able to look up your information in regards to price of prescription. So lots of great little resources at your fingertips when you download the Aetna app onto your phone. I highly recommend it. Now we're going to go into your dental benefits. Now with Aetna, oh, go ahead.
Yeah. I believe, does anybody have any questions about the medical benefits before we move on to dental? Anybody want to jump in with that?
Yeah.
Just unmute your microphone if you wanted to have a question. Okay. Well, I think there was a couple of questions. One was, okay, this enrollment is going to be all through the ADP system. There's no paper forms you to fill out, nothing you need to turn in. It's all going to be online. So your ADP login is used to submit vacation, take time, anything like that. That's the same system you're going to use. Log in there.
Hey, Joe, we got a question.
Yes.
Are they going to get printouts of PowerPoint and all this paperwork? That's really the biggest question.
Okay. After this meeting, I'm going to post up all the slideshows that you're seeing today. They'll be available online through your ADP login. The same place where you can go to download copies of the rates and the benefit summaries. Post the slideshows. Yep.
If people are trying to decide, which HMO plan to choose from, definitely help them download the benefit summaries that are posted. So there's Aetna benefit summaries for each of the plan options. They're probably about 5 to 8 pages, pretty comprehensive, and they go into greater detail about all the benefits we spoke of today.
Okay.
Yeah. All right, we're going to go right into the dental. Keep in mind that for the dental benefits, nothing has changed. Go to the next screen. Thank you. So here's just a high level, review of the plans. Again, as Elsa's mentioned, you definitely want to go on and download the actual full benefit summary so you can take a look at the details. What you're seeing here is just a couple of just different dental services with their ADA codes. On the middle, it's your Aetna DMO. Remember, with the Aetna DMO, you must select a contracted dentist to obtain your dental services. And then on the Aetna PPO, again, you're going to be managing your dental care. And you can go in-network or you can go out-of-network. But under the Aetna DMO, what you're going to want to take a look at is the ADA codes. When you go into your dentist, typically the way it works, you're going to go in for your office visit. You'll have a full consultation as to what dental care you might need. Now, I recommend on either plan, before you sit down and have $2,000 or $3,000 worth of dental care done, you want them to submit into Aetna what's called a predetermination. And that's going to send all those ADA codes along with your dental care that they're suggesting to Aetna, and we're going to review it. We're going to take a look at what they're asking you to obtain for dental services. We're also going to let you know which dental services and codes are not covered under the Aetna dental plans and which ones they're actually upselling you to. Keep in mind, your dental care is not like medical. You are going to be paying a little bit more out of pocket for your services under dental, but we still want you to be an educated consumer. So please be proactive. Go in for your dental cleanings twice a year. If you are pregnant, if your spouse is pregnant, you also get a third cleaning throughout that year. It's really important that individuals are utilizing these services. Your dental hygiene and your care will reflect in your health care. So definitely make sure that if you're under the dental services, go in and have those done at least twice a year. So under the DMO, I do want to just make a comment that we do have orthodontia benefits. I think that benefit is a little cut off at the bottom. But for ortho, it is covered for children up to the age of 18. It says $1,945. There are also additional services that are needed for braces. So I think the total comes out closer to about $2,400 across the board for all those dental codes that you will need. So just want to make sure that it's not the $1,945. It's actually a little bit higher. On the PPO plan, you've got the two levels. You can go in network or you can go out of network. Again, it's really important that you are finding contracted dentists so you can go in network and get the higher benefit level. What you do have is $1,000 of dental services that Aetna will pay for each dependent that you enroll into the plan. So if you enroll just yourself, Aetna will help you pay up to $1,000 of dental care. If you enroll yourself and your spouse and your 5 kids, then Aetna's going to pay $1,000 for each individual. So plan your dental services accordingly. What I always say, and this is a tip that I share, is if you know you're going to have major services done, crowns, root canals, try to plan that November, December to start the services, so that way you can get that benefit, and then January 1st, it resets. And so if it's a big ticket item, then at least January 1st, you can finish your dental care and you can get that additional $1,000 from Aetna to help you pay for those services. So that's one way of using that benefit. So again, no changes here. If you're happy, you get to stay on the same plans. Okay, thank you. This screen is going to talk about how to find your dentist. Again, this is through Aetna.com/.find. It's important that you know what dental care that you're on. If you don't remember, you can always go on to Aetna Navigator and it'll tell you. But this is just going to kind of give you just a brief review. Again, pick the correct product, DMO, for the contracted dentist. If you're on the PPO, it tells you please select the dental PPO/PDN with PPO network. I know it's a long name, but we're a national company, so I apologize. But again, this has been in place for a couple of years now, so everybody should be able to know how to locate. If you need some assistance, please reach out to us and we'll help you through that process. This just kind of talks about some of the tools that Aetna provides to you. Again, we're going to provide you the doc find to help you find your dentist. Along with Aetna Navigator, you're going to be able to find a service called cost comparison, and you can put in the name of the dental service or medical service, and it'll tell you what that cost is in that geographic area. So again, this is a lot of information we've already covered, but please utilize your resources. We want you to be an educated consumer, and we've provided the resources to kind of help you manage your benefits for medical and dental. All right, let's go into vision. We're in the final stretch with Aetna here. Hang in there. All right, so here's vision. So with vision, you have a great plan here. You get your exams every 12 months, your frames every 24 months, and lenses every 12 months. I want to make sure that you're aware that it's every rolling 12 months. So for example, if I went in today to actually go in and get my exam, I wouldn't be able to go in until November, what day are we? We're 15th until the 16th of 2017 to get my new eye exam. And so what's really nice is Aetna will actually send you a reminder at your home. So if you can't remember when you had your last eye exam, don't worry, we'll email you that information. We'll send out a reminder at home, and it's also available on your Aetna Navigator. With Aetna Vision Preferred, we do encourage all of our individuals to utilize our resources, and that's going to be with the specialist with iMed. And you also can go to Lens Crafters, JCPenney, and Sears to get your services rendered. With this, you pay $10 for your exam. Your materials are $10. What I like about this is that it does give you an allowance of $130 for frames. Now, for those individuals that love their Gucci's and their Pradas and they kind of like a little bit more upscale frames, you can apply the $130 and then you get a 20% discount for the additional cost of that balance. So that's a nice little benefit there. Along with that, if you decide, you know what, I don't want glasses this year, I actually want to kind of try the contacts, you can, but it's in lieu of. So 1 year you can do the contacts, the second year you can do the frames, the new lenses, and you can switch between the two. But I do want to alert you that on contacts, you have an allowance of $115. Now you need to utilize the entire amount in one transaction, or not you would forfeit the balance. So if you're going to go into Lens Crafters or one of the iMed providers, make sure that you're using the full amount, $115, okay? Don't use 80 because you're going to lose that additional amount. It just doesn't make sense, okay? Out of network, a lot of people have said, hey, well, I love going to Costco. Me too. The only thing is they're expensive on their eye exams. I actually went in and it looks like it's about $95 for a contact exam. And you look at this, if you go out of network, okay, your exam, we're only going to reimburse you up to $25. So kind of keep that in mind. So my little tip is on this benefit, because I also love Costco, is I'll go into my iMed provider, pay $10 for my eye exam, okay, get my prescription, and then I take that into Costco because I might find a frame that I'll fall in love with. So do know you can kind of go both ways on this and utilize the benefit to your advantage. But if you go in network, you can kind of see that you get a better deal. So that's your vision benefit. I do want to include that when you do enroll under the Aetna Vision, Aetna will actually mail you a customized vision packet at home with a list of all the vision providers and a vision card, and just kind of welcome you to the program. If you do enroll dependents that are over the age of 18, do know that when you go on to Aetna Vision, they would have to go in themselves to download a copy of their vision card, or if they want to look at their benefits online. Okay, so just want to make sure that you're aware of that. Okay. This screen is going to talk about how to find those vision providers. You can also go through Aetna Navigator, and when it says medical, dental, and then it has a little link to vision, you can use that. What's great is when you put in your zip code, it's going to give you all the specialists in your area. As I mentioned, we utilize iMed providers, but we also are partnered with Sears and other individual optometry offices in the community offices. Okay. All right, I invite Unum.
Thank you. Good morning, everybody. My name is Ed. I'm with Unum, and I'll be going over the basic voluntary life and AD&D with Unum. All right. So what we have here is your employer-funded life AD&D. Basically, what it does is it's going to go ahead and do a one-time annual maximum for you. Who pays for the coverage is going to be 100% your employer-funded. This is paid in addition to the benefit if you die in a covered accident. What that means is, let's say you have an unfortunate accident and you do end up passing away, it's going to go ahead and pay twice the amount. It also, if you end up having a dismemberment, if you end up losing one of your limbs, it's going to go ahead and pay you for that. We hope that nobody ever ends up being in an accident or losing one of their limbs from their bodies, but it is an insurance there for you. Okay, thank you. The benefit also includes spouse up to 100%. This is your voluntary term life insurance, which if in case something were to happen to your spouse, you know that you have insurance on them, and you can also cover your children. Now, the difference between a term life, which we are offering on this screen, is that it is for the duration of a life. It has a beginning and it has an end point, versus a whole life that you can keep, and that one's going to be in a future screen, and it'll show you that as long as you're paying the premium and you end up leaving the company, it's a call of portability, you can keep it with you. So the rate doesn't go up on you versus a term life, which it does have an endpoint.
I do want to add that
Yeah.
you also can purchase additional voluntary life insurance for yourself. So the last page was you can either buy additional life for yourself, 5 times your salary, or you can buy some insurance for your spouse and or your child.
Thank you. The group hospital indemnity is always a nice one to have, which you can pair up with your insurance. If you end up being in the hospital and you have those out-of-pocket costs, this insurance will give you $1,000 for each hospital admission that you have. Also, if you end up going into the hospital and you're staying there for multiple days, you get $100 for each day, up to 15 days for the entire year. So as the example gives you over here on the right, this is the average cost of the hospital stays $9,700. And it's true, 9 out of 10 workers with medical coverage have an out-of-pocket maximum for individual single coverage. So 70% of those workers have an out-of-pocket maximum of $2,000 or more. 44% of the individuals don't have at least $2,000 in emergency savings. And this is trying to help you ease any of the costs that would be coming, because sometimes you just don't know when we're going to end up in the hospital, and it kind of helps soften the out-of-pocket costs.
The nice thing about that benefit is that you'll notice that you get $1,000 if you are admitted to the hospital. But if you recall what Letitia had mentioned earlier, for example, one of the hospital admissions is a $600 copay. So if you purchase this, you actually get to use the extra $400, for example, however you want.
Group accident, it's another of our benefits that are being offered. As you probably know, accidents happen anywhere. You can be just out and about at the market, or you can be at home cleaning around, you slip, you fall. The example they give you here, it's a 40-year-old individual, falls at home, and they end up breaking their toe and ACL tear. The out-of-pocket expense incurred is $100 emergency room copay, $500 deductible, $750 copay for surgery, $150 copay for 10 physician therapy visits. So total out-of-pocket is $1,500. How this benefit works, it pays you directly, so you're going to administrate the money. It's going to pay you $150 for emergency room visits, so you get a check for that. $100 for appliances, so it's going to be a knee brace. $150 for the fractured toe. $800 for surgical, because you tore you had a tear there. $75 for follow-up appointments, and $150 for 6 physical therapies. So the total benefit paid under the policy is $1,425. Your out-of-pocket expense was $1,500. So basically, you're going to be paying $75 out of your pocket. If it would have been in reverse, where you had extra money, that's your money to keep. You get to administrate it in whatever you believe you need to. Okay, next, please. Individual short-term disability. This goes on top of whatever you already get paid. As we all know, we do get some disability from the state, but it's a little bit difficult to work with the amount that would be paid out to you. Unfortunately, accidents do happen. Some of the examples that they give here is injuries, but injuries aren't the only reasons you might not be able to work. Most common causes of short-term disability claims are normal pregnancy, individuals having family members, right? Injuries, complications from pregnancies, digestive disorders, back disorders, cancer. So it does cover you for these types of illnesses. How can it protect you? Replaces a portion of your income when an injury or illness causes a disability event. You choose a monthly benefit that fits your needs. The product is non-occupational. Waiver premium is automatically included, and it's a 7-day elimination option for either the 3 or 6 month benefit duration. And what they're talking about there is there's a 7-day if you ended up being out of work because your doctor says, you're ill. They're not going to pay you for the first 7 days. After that, it would pay you depending on which amount. If you said 6 months, it will pay you for the 6 months. The waiver of premium, it's a nice one because when you're out of work, you're really not getting much income. Your income has taken a reduction, so you don't have to worry about making the payment on your policy and then it gets canceled out on you. Whole life was the other one I had I briefly mentioned when we're talking about term. This one is with, again, a whole life policy. It's voluntary. You choose whether or not to purchase coverage and buy only the amount that is right for your needs. In addition to providing death benefits in a policy, can build cash value, which may utilize during your working years. The policy includes a living benefit option to all employees, spouse, children, grandchildren. The policy accumulated cash value may also be used to buy a smaller paid-up policy, which further premiums are due. Rate is locked in, issued age and never increases. Benefits never reduce, coverage for dependents available. So the one that I'd like to kind of focus on is the rate lock-in. As we all get older, we start seeing that how the need of having insurance, but it gets more expensive for us. So our recommendation is always try to get yourself some kind of life policy, and you can keep it. If you're 20 years old, 20 years from now when you're 40, it's going to cost you more. If you're 40 and 20 years from now you're going to be 60, it's going to cost you also. So this is a good way to have it. It does get paid up. So what that means that when you reach a certain age, you're not going to be paying any more on the premium. The premium cost has already been paid for, so all you have to do is just enjoy your life. The benefit never reduces. So it's not like some policies where you get yourself a $50,000 policy, and the next thing you know, you're asking, well, what happens to the policy? Why isn't that $50,000 anymore? I've been paying for it for the past 15 years. So you're not going to be getting any type of surprises. Okay. Well, hopefully, I've been able to cover the different voluntary benefits for you. If you have any questions, you can give us a call at 1-888-735-3557. As you notice there, the representatives will be there for you from November 14th to November 23rd. It's 5 a.m. to 5 p.m. Pacific Standard Time. We are based out of the East Coast. We just like to tell people it is California's time. For any customer service questions regarding voluntary benefits, it's the same number. Well, different number. It's a 1-800-635-5597. And then you got the hospital indemnity group, accident, short-term disability, whole life plans. Must be enrolled via Unum. You can call the call center, and they will help you out. If you have any other questions that you want to know before you sign up for the benefits, they have people there to help you out.
All right, just so you know, also, I included this number to Unum at the very end of your benefit enrollment. So as you enroll with all your basic benefits congratulations, you're done with your benefits. There'll also be the 888 number so that you can call Unum as well. It'll be on the slideshow, and I'll put the slideshows again on the your ADP login, but you will have it at the end of your enrollment.
So this is just a slide on the employee assistance plan that Unum offers to PowerPlus employees. It is through their partner Ceridian. So in the event you have any work-life issues at home, or looking for referrals, for elderly care or child care, or financial and or legal questions or issues, there is this 1-800 number here that you can call 24 hours a day, 7 days a week, and you will speak to a licensed counselor. And if they feel that you would benefit from having 3 face-to-face visits or an in-person visit with a counselor, they will set that up for you. And there is no cost. It does not at all touch your medical plan. But if it's the case that you do need more visits or sessions, it is possible that they can coordinate with your medical plan, and then you can obtain additional visits via the medical program. But this is a free benefit that PowerPlus does purchase for all of its employees. So definitely do use it in case you feel like you might need it. So I'm going to touch upon flexible spending accounts. This is a great benefit to think about, especially if you think you might have any out-of-pocket costs. Any of the co-pays or co-insurances that Letitia spoke of earlier on the medical, dental, or vision plans. You can actually set aside some of your payroll dollars and get it back on a tax-free basis. So there's 2 types of accounts you can participate in. One is a healthcare account, and for 2017, the maximum amount you can contribute is $2,600. That did go up from 2016. And then there's also a dependent care account in case you have any children that you pay, a company or somebody to watch for example, before school or after school, or maybe you have an elderly parent that's tax dependent, you can put up to $5,000 aside on a pre-tax basis if you're married, and again, get those monies back on a pre-tax basis. So this does lower your taxable income, which means, of course, lower taxes to you. Do know that the monies for the healthcare account do not roll over from year to year. So you want to be conservative in terms of estimating how much you might want to put aside. But for example, if you're on that drug on a monthly basis, you pay $50 a month for that, brand non-formulary drug. That's $50 times 12 months. That's $600. You might want to think about putting aside at least $600 and getting that back on a tax-free basis. Just want to point out, if any of you are planning to enroll in that very high deductible $5,000 OEMC plan that Let's just spoke about, you are not allowed to contribute to the healthcare FSA. And that is because you have the option to participate in that other type of account called a health savings account, which I know they sound very similar, but they're actually very different. And that one, you're going to want to open that at your local bank. So this one is through payroll deductions, but the health savings account is just kind of on your own, and you just open the health savings account at your local financial institution. So just to give you some more ideas of what you can use the monies for on the healthcare side, on the left-hand side, you can see here that I mentioned any of the deductibles, the copays, the coinsurance that you have to pay out. If you're on the vision plan, or if you're not even on the vision plan and you have contact lenses, or you purchase eyeglasses, or you need contact lens solution, or for example, hearing aids, those are very expensive, or maybe you've blown through the $1,000 dental maximum on the PPO plan, and you have a lot more work you need done. You can put aside the monies and pay for the root canals or the orthodontia. So there's a lot of things that you can, as you can see here, use with those healthcare monies. Pretty much you can think about anything to treat an illness or an injury, anything that's medically necessary. Do know that cosmetic surgery is not covered. So for example, teeth whitening, you cannot do that and get reimbursed on the healthcare FSA. However, you can get LASIK, vision correction surgery, which is not necessarily cosmetic surgery. It is, a medical necessity. So that you can get reimbursed on the healthcare flexible spending account. So again, $2,600 a year you can set aside. They will withhold that from your paycheck evenly throughout the year. But do know you will get a debit card at the beginning of the plan year with the entire amount of your election for the plan year on the card. And then on the right-hand side, the dependent care, like I said, anytime you have children under 5 and you pay for them to be in daycare or Montessori school, up until age 5, you can actually deduct the entire amount and get reimbursed. After that, before school care, after school care, day camps during the summertime, or if you hire someone to come to your home and take care of an elderly or disabled parent or child, like I said, you can get all of those monies back on a tax-free basis. If you file your taxes as an individual or just had a household, it's only $2,500 a year. But again, if you're married filing jointly, it's $5,000 a year. So with that, we pretty much covered all the benefits. Now we're going to talk about some details and housekeeping items. You're probably... So I'm not familiar with that slide. Okay, there we go. So here you're probably wondering how much things cost. We talked about the medical, dental, and vision options. I believe things have gone up, fairly minimal. So the medical payroll deductions on a per paycheck are up above. You can see here, you guys have, in California, you have 5 medical options to choose from, except for the folks in Northern California, you will have 4. And then you still have the 2 dental plans you can choose from, the DMO and the DPPO, and then the vision plan through Aetna. And you can see, again, I believe the vision premiums didn't change and the dental ones just went up slightly. And I believe you'll also see these same numbers on the ADP system, so you don't have to write those numbers down. But just a reminder, you can see here that open enrollment ends on November 23rd at 5 o'clock Pacific time, so definitely log in the system before then. I believe if you don't log into the system and you don't make election, you probably have no benefits. Is that right, for 217?
Yeah, we're saying the cutoff November 23rd, 5 p.m. So please call Kristen or myself, anybody in HR. If you're having any difficulty getting into the system, we'll go ahead and work with you to get that done. Just another thing about the benefits. From what I understood, we had a 3% increase across all our benefits. And the word around town is that a lot of companies out there are getting triple that. It's going up very high with other companies. The Power Plus has been very fortunate. And the company itself has absorbed a lot of the costs so that we can minimize the impact to you, the employee. So from the employee side, it may sound like 3%, but it could be much, much worse. And that's not the case with Power Plus. So just wanted to let you guys know that. And also when you're enrolling in the system, you'll be able to see what Power Plus is paying versus what you're paying. And you're going to be able to see that huge impact that Power Plus is taking. So that's just another added benefit for us. We have a low percentage increase where others are taking a pretty big hit.
Yeah, I agree with Joe that this year we definitely worked really hard to keep the cost increase down. That's why we had the minor plan design change on that HMO deductible plan. But it is definitely the case where other employers are facing actually double-digit increases. And so we're very happy that we're able to keep that at a minimum. And that's definitely thanks to Letitia and her team, as well as Power Plus. So just be sure to log into workforcenow.adp.com by next week. And this is the place that you're going to have to tell us if you want to enroll or decline in medical, dental, or vision coverages. Be sure to select the coverage level for each plan. They can all be independent and different. You're going to want to add or delete dependents from coverage at this time of year. And do know that you can cover your dependent children, whether or not they live with you or not, up to the age of 26 on medical, regardless if they're a student or not. So if you're going to be kind enough to cover your children, do you know that they can be covered on the Power Plus plan up until the age 26? So.
And then also with the ID cards, again, they're going to all be digitally through the Aetna Navigator.
It is. And what's important to remember about the Aetna, ID cards is if there is no change, if you're not changing benefits, you're still going to utilize what you have today. The only plan that had changes, as Elsa mentioned, and that we covered is the HMO deductible plan. And so because the HMO deductible had a change on the primary care physician and specialist, anybody that's enrolled on that specific benefit or will move to that plan, the HMO deductible, then they can get their digital cards through Aetna Navigator. If for whatever reason they've never been on Aetna Navigator, then our Aetna system will be forced to send them a copy at home. But again, we encourage you to go onto Navigator because that will be the fastest way to get a copy.
If somebody goes from the basic to the full and completely changes, they'll get a new card.
Absolutely.
Okay, so
Yeah. So any plan changes, you'll get a new card, but no plan changes, no new ID card. You can still use the same one that you have today.
Mm-hmm.
So be sure to call the UNUM enrollment line if you're interested in any of those voluntary benefits, like group accident or the short-term disability plan, the whole life or the hospital indemnity plan. The phone line is also open pretty much the same timing as when you have open enrollment. So be sure to call by next week. And just know that whatever changes that you make in the system next week, up until next week, those elections and changes aren't effective until January 1st, 2017.